Hey you guys, how you doing today? I just wanted to make a quick video and basically reflect on my clinical experience. I really enjoyed my clinical experience, as an LPN. When I went to LPN school, we did nursing home. We really didn't do the hospital except for peds, but we really didn't get to do any assessments or anything. We just basically went. But this clinical experience has been great. I did postpartum, labor and delivery, and last night I did NICU. And I know I might look a little tired. I am tired because I do a lot of ripping around as far as, me staying an hour and 30 minutes away from my school and me having to do clinicals and stuff. I'm drained and I still work. So it's an experience, it's a lot. Nursing is already a full-time job, and having a full-time job on top of nursing, it's a lot. But sometimes you got to do what you got to do. But I just want to share my clinical experience. The first rotation I had postpartum, and it was great. I had my patient, she had a C-section, and on postpartum, I basically took care of her. I got the experience of touching the fundus and looking at the lochia and making sure her pad wasn't fully saturated, because if it fully saturates, she can hemorrhage after having birth. And basically I got to check the sutures and make sure it was okay. So I enjoyed my first clinical. The second clinical was labor and delivery. I got to see a cesarean. I got to see a C-section, and I loved it because with my baby, I had a C-section too, but I never knew everything that they did until, I went to nursing school. So I was excited about that. I was in the room. I was right there at the foot of the bed. And, at first when I was looking, I was kind of, I never seen that much blood in my life. So I was thinking I was going to pass out, but I actually did good. I had to tough it up. Me and another student was in there, and he was in like, look at this, look at this, look at that. And I'm like, hold on, you take me too fast. Let me kind of absorb it. Let me take it in, before I get to moving around the delivery room and seeing this and seeing that. But I got to see the C-section. I got to see how the fallopian tubes look. I got to see how the uterus look. The book do not justify what you see in person. And I was so excited about that. I went around telling everybody because I was so excited. Of course, I seen the baby get her assessment after the baby was born. The Agar scoring and all that. How they put the baby in the warmer. So I was excited about that. Last night, my clinical was basically in the NICU. I got to see a full head to toe assessment on the baby. And I got to see the giraffe, where they keep the baby in to basically keep their temperature leveled. I got to change some diapers. I got to feed. So my clinical experience was great. It was totally different than what I experienced in my LPN program. And I know I feel so sluggish because I am. I'm I look like I'm tired. I am. But the only thing that I would say that I would be more selective of is my classmate. We was in groups. Basically, I asked her because my clinical experience my clinical instructor, bear with me, y'all. She gave me me and my classmate 100 questions to do. We had to do 50 for the first rotation, and basically the questions, I wish I would have did the questions before I did my first OB test because it really helped. So I was like, they're not going to catch me slipping again. So I did the rest of the questions. And basically, I feel like what I'm learning in clinical is basically the questions that are being asked. If, you know, you see information over and over again, that's a good thing because it might be on your next test. So back to my classmate, I asked her, I said, hey, did you do your 100 questions? She was like, no, I didn't get a chance to do it. I'm not doing that mess. I said, well, you never know, it might help you. You know, me trying to be supportive because I want everybody to make it. So I let her copy my question because the questions are not for grade. So I let her copy my questions. And, you know, I thought we was cool. You know, I wasn't trying to make friends. I was just trying to help out. So we get to feeding the babies. And my classmate asked about when do the interior front of nails close and the posterior front of nails close. So I said, you know, 12. I said 12 to 18 from the front, 2 to 3 for the back. And she didn't believe me, so she went and asked the nurse in the nursery, and she was like, I don't remember, you know, but I think it's 18. So you don't know when the front nails closed, but you handling the baby. Anyways, that's a different story. So she was like, I don't think that's right. Telling me I don't think what you saying is right. I said, okay. So she looked it up and I looked it up. And it says 12 to 18, 2 to 3. And then I was like, yeah, you see, it says it right here. And she was like, I'm glad you read your textbook. I don't like people that textbook smart and think they know it all. So I'm just looking around like, we have an OB clinical and you supposed to know this. But I didn't say anything because I'm learning to control this tongue in my mouth, because what you say can hurt you or help you. So I'm learning to control what I say to people. So I just got my stuff and, you know, went to the other unit with my classmates was, because how you gonna get mad at me for telling you something, but you wasn't mad at me when I gave you my questions? Like, can't you see I'm trying to help you? So when you go in these clinical settings, they won't say these students don't know anything. You know, I'm trying to help you. I'm trying to better you. I'm trying to get you to be prepared for the test. But I really learned you can't help everybody, because everybody don't want your help. And when they do get your help, they're more selective on what they want to, you know, take in, or what they want to use you for. And then after that, it's like, forget you. You know what I'm saying? I don't like her. So it's gonna always be people like that. You know, I don't think I know it all. It's a lot that I don't know, but I'm gonna read up on it so I can know when it's time to know it. So yeah, overall I did have a good clinical experience, but beware of people that don't want to help themselves. You can't help everybody. You can't save everybody. Everybody ain't gonna move to the next level with you. So I just wanted to share my clinical experience because I had a good clinical experience. I'm finna head out and go to work. Y'all have a good day. I know some people been leaving me comments about, you know, their kids being in nursing school and how my videos are helpful. So I'm gonna try to continue to do more videos, but like I said, my schedule is hectic and I have to sleep when I can. So anyways, again, have a nice day. Thank you for watching my video.